Good evening, everybody. This is the Central District Board of Health meeting for October the 13th, 2020 at 5:15 p.m. I thank everybody for participating in our meeting this evening, and go ahead and introduce myself. I am the presiding chair, Betty Ann Nettleton from Elmore County. Our other Elmore County representative is Representative Megan Blanksma, and we'll go ahead and call the meeting to order at this point and take roll call by county, starting with Valley County.
Commissioner Hasbrook here.
Boise County. Boise County, I don't hear a response. Elmore County.
Representative Blanksma here.
Ada County. Jane Young, are you there?
Yes, Jane Young.
Ted Epperly here.
Okay.
Commissioner Lachiondo here.
Okay. Thank you, folks. Okay, we'll proceed on with action items, and under there are there any changes to the agenda, Russ?
Madam Chair, this is Russ. There are no changes to the agenda that need board approval.
Okay, thank you. All right, we will proceed with our minutes from our September 22nd meeting. Are there any corrections or additions to those minutes?
Madam Chair.
Hearing none, I will ask for a motion for approval.
Madam Chair, this is Representative Blanksma. I move to approve the minutes from September 22nd.
Second.
This is
Good. Who was the second?
Jane.
I'm sorry, I didn't. Jane? Okay,
Yes.
Thank you. No further discussion, so we'll go ahead and take a vote by county, starting with Valley County.
Commissioner Hasbrook, aye.
Boise County. Brian is absent. Elmore County.
Representative Blanksma, aye.
Ada County.
Jane Young, aye.
Ted Epperly, aye.
Commissioner Lachiondo, aye.
Okay. Thank you very much, folks. Okay, the minutes from our September 22nd, 2020 board meeting stand approved. Moving on with our agenda, we will now do a review of our COVID-19 metrics for criteria, determining quarantine and restriction orders for Ada County by Kimberly Link, our communicable disease control manager. So, Kim, thank you, and the floor is yours.
Okay, thank you, and good evening, everyone. Dustin, could you please pull up the slide set that includes the COVID information? And while this is loading, so the first page of this is the page titled Central District Health Ada County Criteria Summary. We had some period of time where our case numbers were decreasing. Unfortunately, that's not the case anymore, and our case numbers are on the rise again. As we look at our criteria for county level restrictions, under the hospital criteria, our ICU admissions have remained relatively stable over the past couple of weeks, but we have seen increases in non-ICU admissions. Our case counts, as I mentioned, are increasing. Last week, we had a 22% increase in the number of cases reported as compared to the week prior. And we did have a 3-day stretch last week where the total number of cases reported for Ada County residents was over 100 cases per day. We continue to have a number of clusters and outbreaks that we are monitoring. So we are continuing to see cases related to faculty, staff, and students at Boise State University. There are cases continuing to be reported out of Idaho Department of Corrections facilities here in our area. We are continuing to see cases being reported out of the Ada County Jail, and there are 25 long-term care facilities in Ada County that have active COVID outbreaks going on at this time. And if you could move to the next slide, please. This next page is the one titled Hospital Criteria. And you'll see for this top graph on the left-hand side, we have a bar graph that includes the past 4 weeks, number of cases being hospitalized, not in ICU care. We had a period of time where these hospitalizations were in the single digits. Unfortunately, what we've seen is that we are now moving up into the teens for daily hospitalizations. And if you look to the right-hand side, that's that same data on a 2-week trend with a dotted dash trend line applied to it, and that trend line is moving upwards. So we are seeing an increase in those hospitalizations. And if you could move to the middle set of graphs. This middle section includes those people who are in ICU care. This has been much more stable over the past 2 weeks and really over the past month as a whole. We are still seeing that the number of ICU admissions are staying in single digits, and that trend line, while it is very slightly upward, I think could be well described as being flat at this point in time. As we look at the bottom sets of graphs, these are looking at a little bit different data. So these are the number of admissions that are happening in Ada County hospitals. So not just the Ada County residents, but residents of any part of Idaho or any place else that a person may be coming from, Washington, Oregon. You'll see on the left-hand side the non-ICU admissions. We are seeing a slight increase over the past couple of weeks. However, when we look at that as far as the bigger picture, we are still sitting much lower than we were earlier on this summer. And same for the ICU admissions on the right-hand side. We are seeing some overall increases from our low point that was during the month of September. But thankfully, we are not at the point where we were this past summer. And if you can move to the next slide, please. This is the slide titled Disease Criteria. This top graph looks at the total number of Ada County confirmed and probable cases, so includes cases from within the community and also those who are in Department of Corrections facilities here in Ada County. And you can see that over the past 2 weeks, we've seen a fairly sharp increase in the number of cases being reported, with the number of days of more than 100 cases being reported, again, being on the increase. So we did have a 3-day stretch this past week where our numbers were over 100 cases. If you could move to the middle set of graphs, please. So this is that same Ada County information. It removes, though, the IDOC inmates. So this is looking at cases that are more closely connected to the community as a whole. You'll see that our trend line is still going upward when we're looking at those cases that are based in the community. We did still see that we had that 3-day stretch where we went over 100 cases being reported as well. So cases are solidly on the increase at this point, and definitely 2 levels that, based on our gating criteria, are concerning. Again, having those 3-day stretches where we have more than 100 cases being reported is an indicator that our cases are definitely increasing and maybe reaching the level where we may see strain on hospital capacity. And the bottom graph includes a longer-term view of our cases based on week of report for Ada County residents. And you'll see that we have been up on an upward trend for a number of weeks now. So we did have a trough the week of September 6th with 332 cases being reported. Right now we are sitting at over double that with 821 cases being reported last week. If you can move to the next slide, please. And this is the slide that's labeled Ada County Case Rate and Emergency Department Syndromic Surveillance Information. So the top graph includes information about the average daily case rate per 100,000. This is the measure that we are using for the school categories. And last week we had anticipated that it was very likely that we would be going over 20 per 100,000, and that was indeed the case. So we are currently reporting out for our past 2-week period 22.14 cases per 100,000, which is category 3 or red for Ada County schools. The middle set of graphs includes information about emergency department visits. These are people who are presenting to the emergency department with symptoms of fever, cough, and shortness of breath. And they are either not being tested for flu or are testing negative for flu. So being known as COVID-like illness, you'll see that these numbers have been remaining mostly in the single digits at this point. And when we look at that on a 2-week trend, that is remaining mostly flat as well. And I believe we have one more graph at the bottom. Yes, and so this is the graph as we see by week of that COVID-like illness and a slight decrease in the past week as compared to the week prior. And so that's our data in a nutshell as far as the formal dashboard goes. When we're looking at our cases as a whole, again, we're in a situation where our cases are climbing. Based on case interview, about half of our cases at this point are indicating that they had exposure to somebody that they knew had COVID. So we're looking at exposures that are occurring in different versions of family and social clusters. We are seeing right now that about a quarter of our cases are being classified as community transmission, meaning that they didn't leave the Treasure Valley area, they didn't have somebody, a contact that they knew had COVID, and that they really don't know where they might have picked up the illness. So that's definitely something that we want to keep an eye on. It's been staying pretty consistently at about 25%. One of the big changes, and of course, as we look at the way that people do seem to be picking this up, whether there are commonalities in terms of reporting. One of the big changes that we saw from the time point that our cases started rising is that schools went back into session. And knowing that there was going to be a bump in the number of cases, that was something that it was completely expected. Anytime that we see that people are coming together in a social or work school type setting, we know that there's going to be that increased risk of transmission and can be accounted for. We are seeing, it's hard to say which is the driver. Is it community transmission is driving increased numbers of cases within the schools, or is it increased number of cases in schools driving community transmission? We are seeing increases in the number of schools who are being impacted by having individuals within their buildings who have COVID. So this past week, we were at over 35 schools that we worked with for COVID-related situations, and that's an increase over the week prior. And I think as we see cases increase in the community as a whole, that number is going to continue to increase. We know that schools are looking at continuing to move forward with bringing in students, increasing in-person learning. And as that continues to go on, that's going to increase the number of people who are infectious within the school setting, especially as our case numbers continue to increase. So as schools are working through their plans, it becomes even more and more important that they are adhering to masking and physical distancing throughout the entirety of the school day, from the time that a person gets on the bus or in their car to the time that they're leaving for the day, just to help prevent transmission within the school setting itself. We have not seen large amounts of transmission from the school setting proper, although we have had exposures that have occurred. But where we have seen transmission occurring, we've seen large numbers of quarantines happening as a result of exposures, is in athletics, and that's both school-related athletics and then also club and league athletics as well. That seems to be picking up as we move through the weeks. And unfortunately, what we're finding in these situations is that, especially if there are situations where there are multiple people who are infectious at the same time, it becomes very, very difficult to be able to determine whether or not a person is not a contact. And we're seeing that we're having situations where entire teams are being recommended for quarantine, which of course takes them out of in-person learning for a 2-week period of time. And in these situations, we have seen transmission occur, so transmission among teammates and also then transmission back into the families. We're working through a number of situations last week where teams are being put out onto quarantine now. We're starting to see additional cases being reported among those teammates. So we'll continue following those to try to determine how far out that spread goes, if we're seeing additional transmission into family members, household members, and out into the community as well. So that's definitely an area of concern for us. And it's one that does have the potential to impact the community as a whole and has the potential of impacting the success of in-person learning within schools. And so I think something that we need to be aware of and keeping a very close eye on. And that's the end of my formal report. I'm happy to take questions.
Madam Chair, this is Diana.
Thank you, Kim. Yes, Diana, go ahead.
Kim, could you go back to the clusters and kind of talk through the Boise State clusters? And you and I have had this conversation prior, but again, I think this is our opportunity to share with the world all the things that we're learning. My understanding, I don't want to put words in your mouth, is that similarly, it's not in-person learning. That's the problem at Boise State. It's off-campus socialization, parties, etc. Could you elaborate on that?
Sure, Madam Chair, this is Kim.
Yes, Kim, go ahead.
Okay. Yes, in general, so what we're seeing with Boise State, again, I think they actually have an excellent dashboard on their website that tracks information about faculty versus students and then on campus versus off campus as well. And what we're finding is that the majority of the cases are coming out of the student population, so not so much from faculty and staff. And when we're looking at on-campus versus off-campus, the majority of these students are living off-campus. What we're understanding from our contact tracing and also working with Boise State as well is that the processes and plans that they have in place for on-campus within classroom learning is effective in ensuring that exposures aren't happening. And so what we're seeing is that these exposures and transmission do seem to be occurring outside of school, so through different types of social interactions, whether that is friends getting together potentially to study or parties, going out, different things like that.
So earlier this summer, when we had the bar cluster start, you know, there could, of course, still be adverse effects for that age range, but it's less likely. And if it had stayed in that age range, we would not have likely seen the hospitalization and then deaths. I want to ask you publicly the question that I've asked before, which is, are people starting to make different choices? So that is, if they're choosing to hang out with their friends, are they then not choosing to hang out with their grandma or someone who would be more vulnerable? What are you starting to see in sort of that trending or that contact tracing?
Madam Chair, this is Kim.
Yes, Kim, go ahead.
Okay. We're seeing a variety of actions on the part of people who are being diagnosed with COVID. Definitely one thing that we're hearing is that people have an increased amount of awareness that once they become positive, that it is more important for them to isolate. I would say the majority of people that we're working with are isolating in their current residence. So like I said, a lot of folks are in off-campus housing, apartments and whatnot, close to the university, and so they're staying there during their isolation period. We do see that there are some people who are opting to stay with their parents during that isolation period. In those situations, we are talking with them about how to do that the most safely to ensure that they are indeed isolating and not potentially exposing other family members in that process.
Madam Chairman?
Yes, Megan, go ahead.
Yeah, I have a question, Kim, about the long-term care facilities and how that those clusters are occurring, because I've had multiple phone calls from people who are concerned that they haven't been able to see loved ones for moving on 6 months now. But at the same time, what we do is we have care workers that are going to bachelorette parties in Las Vegas. So I'm just wondering how these clusters are occurring. Is this because the residents are giving it to each other? Is it because caregivers are coming in and bringing it with them? And if that's the case, is there a way that we can start making arrangements for loved ones to come in to see their family, provide them with proper PPE, whatever we need to do to make that happen, rather than to continue to shut them out? Because I just have a lot of concerns and have received a great deal of phone calls on that issue.
Madam Chair, this is Kim.
Yes, Kim, go ahead.
In terms of looking at our long-term care outbreaks, I think they are, the virus is making its way into the facility by and large through staff. We have seen increased testing that's going on, increased awareness for signs and symptoms, and I think we've had a number of outbreaks prevented recently as a result of that increased awareness and testing. But yeah, it's by and large from staff coming into the facility while they're infectious. We know that unfortunately people are infectious up to 2 days before they show any signs or symptoms. So there is, a certain part of this that cannot potentially be mitigated. We have seen some situations where it seems most likely that residents were exposed during times that they had left the facility, whether it was for a medical appointment or some other type of appointment that they needed to leave. But I hear you as far as looking at safe visitation. I know that's something that we've heard a lot of feedback from as well, from facilities, from family members, and it is a situation where we look at the risk of COVID, but then we also need to look at the other side of the mental health effects of these individuals who are not being able to be in contact with their loved ones.
Madam Chair, follow up, please.
Yes, Megan, go ahead.
Thank you. So Kim, are you working on a plan so that people can get in to visit their loved ones? Because this sounds really counterproductive. The fact that people can't visit their loved ones, but we're letting staff in, and that's encouraging spread. So is there some sort of, because I have emails that I will share with you if you want them, of people who have made suggestions and some of the links that they're willing to go through. So even if they can just get one family member in, that they would take that. If they can take a designee, if they can. So I'm just asking, are you working on some sort of plan so that we can have an action item? Because I think the long-term care facilities are getting lost in this whole discussion, and everybody's very focused on bars, restaurants, and kids going to school, and we forget about all of our grandparents that are in those facilities. So I guess I want to be reassured.
Madam Chair, this is Russ.
Yes, Russ, go ahead.
Yeah, so we are starting conversations to Representative Blanksman's question, and for the very reasons that she's brought this up, is they have been, visitors in Ada County have been prohibited pretty much since the March 25th orders went into place. And then there was a short window of time in June prior to our orders for Ada County going into place. So we have started just the discussions about how to do this with reduced risk. As everyone knows by now, that is the highest risk population for severe consequences. So we need to be careful about it. I do think we're going to need to move forward at some point. With the cases continuing to climb, I don't know that the time is right now, but the short answer is yes, we're starting conversations, and we will put a plan together to allow that to happen at some point, bring it before the board to discuss.
Madam Chair, this is Elk.
Yes, Elk, go ahead.
Well, not only are we need to set up some kind of a system for the elderly, but we also need to set up some kind of a system in the hospital so that people that are seriously ill, their family can go and at least see them through a glass window or some kind of partition or has some kind of conversation, because this has really gone beyond anything that makes common sense anymore. And a lot of this stuff, we do it at, at the counties, we've done it at restaurants, everybody's put up plexiglass. We can figure out a way to keep our lives going without just saying, no, you can't come in and see grandma anymore. That's got to change. So I would encourage Russ to get that one on pretty quick.
Madam Chair, this is Diana.
Yes, Diana. Yes,
So
Diana, go ahead.
I just want to ask a clarifying question for Russ. We have put the restrictions on long-term care based on the governor's prior stages, but my understanding is that the hospitals themselves have put the restrictions in for their facilities. Is that correct?
Madam Chair,
Yes, Russ, go ahead.
that's exactly correct, Commissioner LaShionda. Those are policies and practices within the healthcare system. It doesn't have anything to do with CDH or our current orders.
So Russ, this is out. Would we still have an influence on that? Or are they going to tell us to take a high dive in a low well and they can do what they want?
Madam Chair, this is Russ.
Yes, Russ, go ahead.
We actually, Commissioner Heshbrook, we work very closely with the hospitals, more, sharing of data, talking about things we can do to reduce the spread in our community. And we could certainly offer that as an opinion. And I think to your point, it's more on the other impacts that's COVID is having on families outside of the direct health impacts. So I understand what you're saying, and we are in routine communication with our health systems throughout our public health district, and we can start that conversation.
Thank you.
Madam Chair, this is Ted Epperly. I've got a comment and a question.
Yes, Ted, go ahead.
As far as the hospitals go, they work very closely with their patients and the families of those patients. Not only in terms of trying to make sure they do communicate, but by helping facilitate that. So let me assure you that it matters to them, that they try to make sure this works as best as they possibly can for their patients and their families. They've used means such as we're using right now in terms of both Zoom technology, Facebook, other technologic supported face-to-face interactions that are through a media like this, so that there can be some degree of quality time, the best as possible. Phones, they do have folks come in and certainly can participate as is appropriate with the care and with being in the locations. So I think that just for the sake of, again, the public that might be listening and for us as a board, the hospitals, I think, are to be commended, quite frankly, in terms of how they've tried to adapt to this for their patients. That comment made, I wanted to ask another question, and that's to you, Kim. All of this work that's being done is quite extensive. So, Kim, to you and your team, your staff, how are we doing in terms of the internal team being stretched thin in terms of all the contact tracing necessary? This is an important time. We're seeing a rapid uprise in cases. How's the community tracing going?
Madam Chair, this is Kim.
Yes, Kim, go ahead.
I would say overall, I think we're doing okay given the circumstances. We're definitely, in terms of our case counts, higher than where we would be if we were working under ideal situations with our staffing. We are continuing to staff up in terms of our investigators that are coming on board. I will be honest in saying that working through school-related exposures is much more complex than I think even I initially recognized when we are working with both the family and then with the schools to determine what that student's day looked like or what that staff member's day looked like. So, what did it look like while they were on the bus? What about each of the individual classrooms that they were in? Who did they sit with during lunch? How far away were they from one another during lunch? And then again, adding in those extracurriculars afterward as well. So whether it's sports or yearbook or band or any of those, just increase the complexity. I think that's the area where having increased expertise in terms of more epidemiologist level staff is going to be the most beneficial to us. But I will say by and large, we are remaining reasonably current on our case investigations. There are some days where we are not contacting everybody within the 24-hour period that we would really like to be in. However, I feel that we're sitting in much better shape than we were for contacting people than we were earlier this summer.
Thank you, Kim.
Madam Chair, this is Diana.
Yes, Diana.
I'd like to circle back to Representative Blanksmith's question on the long-term care facilities. And Russ, you know, I similarly, and I think other board members as well, have had a lot of questions and comments, and from people who really want to protect their loved ones and understand the situation that we're in, but are, to Representative Blanksmith's point, you know, we are, you know, we're dragging on here, and there is a mental health component. So would it be appropriate to ask you for a date, Russ, to when you think we might be able to have some kind of plan for visitation with long-term care facilities?
Madam Chair, it's Russ.
Yes, Russ, go ahead.
Yeah, I think that's a very fair question. So we have our meeting this coming Friday. That's our regular board meeting. It starts at 8:30, so we don't, you know, we could update the agenda. I think it's a bit too soon to get all of our thoughts organized around this. The next meeting would be Tuesday, October 20th, so a week from today, or the 27th. And I would just ask for the board's preference. We will get it done either for the 20th or the 27th of October.
I mean, is that something you think that you guys could accomplish for next week, for the 20th?
Madam Chair, Russ.
Yes, Russ, go ahead.
Commissioner Locke, I think we can get it done for the 20th.
Madam Chair,
Yes, Megan, go ahead.
just a point of clarification for us. So are you just coming up with a plan, or are you coming with a recommendation potentially on the 20th?
Madam Chair, this is Russ.
Yes, Russ, go ahead.
That's a good question. What I would envision is doing something similar to what we did with bars, where they were allowed to reopen with restrictions and an approval of a plan from Central District Health. And that is what I would suggest versus just, you know, lifting the, currently it's prohibited to have visitors at assisted living long-term care facilities. So my recommendation will be to modify the orders with certain restrictions in place, and it's the restrictions that I'm going to work through with my team and present that to the board.
Madam Chair.
Yes, is that you,
It's
Megan?
Megan.
I'm
Yeah.
getting a little bit of feedback. Go
Yeah.
ahead.
Yeah, I just wanted to that point, Russ, and it's weird because you're sitting right there and I'm looking at the computer. But if you want any of the suggestions that I've had in email to help, you know, collaborate on a plan, that's great. I really hope that we come with some sort of recommendation and board review and doesn't necessarily come with a change in the recommendations and the orders. Then it would be, I would find it frustrating to sit through a meeting and hear about a plan that could have been, you know, just put out for the public's consumption if we're not going to get some work changes, if that makes sense.
Madam Chair, this is Russ.
Yes, Russ, go ahead.
Yes, Representative Blanksmith, I'll be coming forward with a proposal for the board to take action on Tuesday, the 20th, that will include allowing visitation to long-term care facilities with restrictions.
Madam Chair,
Okay, thank you, Russ. Who's speaking?
this is Jane.
Oh, hi, Jane. Go ahead.
I just had one question. That is, when you are talking to the nursing homes or the extended care facilities, have you learned from them anything that they're willing to do or that they've already done towards this end?
Madam Chair, this is Russ.
Yes, Russ, go ahead.
Dr. Young, they have done, they actually have had some visitation where family members would not come into the facility, but use headsets, much like Representative Blanksman and I are using right now, and communicate through a complete physical barrier where the visitor would be outside and the family member would be inside. And I know they've also set up some accommodations outside where they've placed physical barriers between a family member and the resident of the facility. Now, there's obviously no physical contact. Communication can be a challenge in some instances anyway, even sitting in the same room. So there's been some of that work done by many of our long-term care facilities, and it does provide that very high level of protection. So this would be taking it to the next step. And of course, with cooler weather setting in, we need to figure out the accommodations for indoor visitation.
Okay, thank you, Russ. Any further discussion or questions for Kim before we move on?
Madam Chair, this is Ted Epperly. Yes, I do.
Yes, Ted, go ahead.
So I want to return to the schools for a second and make sure I understand where we stand with all of this. So we certainly know cases are going up in the community, and we've stuck to a very simple metric so that we can make it as clear as possible to schools and to parents. And that's the number of cases per 100,000. And we know that with a rolling number over 2 weeks when averaged, and we know that has now entered into the red zone. Have we altered anything in terms of recommendations to the school in regards to what they can do to help mitigate against this? Or are we just in a position of reporting the number to them so that they can follow their operations plan and make the decisions on the ground based on the color category we're in?
Madam Chair, this is Russ.
Yes, Russ, go ahead.
So what Dr. Epperly is asking about is really related to the next agenda item. I can address it, and then I was going to walk through kind of the history of our engagement with the schools and how we got to where we are today. But specifically, we are very engaged with all of our schools. The board members are well aware of that, and we are continuing to emphasize the things that we did throughout the summer with our operational plans. The specific recommendations that we're making is to continue with the physical distancing. We're recommending that schools should be slowing down their reopening plans and adjusting accordingly to reduce the risk. And part of that reopening is they have much smaller class sizes now, so physical distancing is allowed. There's the concept of pods to keep a group of maybe 3 to 5 students together and have them do other things together, like for recess or breaks or lunchtime. We're also recommending that schools need to continue to evaluate their at-home and hybrid models if they're operating in a 5-day-a-week instruction. So everything that we've basically done, we're definitely continuing to emphasize that as we're now in category 3 or red.
So, Madam Chair, a follow-up if I can.
Yes,
Madam
yes.
Chair, point of order.
Yes, Megan.
Yeah, if what we're going to do is on to schools, then I would suggest to move on to the next action item.
I'm sorry, I didn't get that, Megan. I'm getting feedback.
Sure. I'm just suggesting if what we're going to do is move on to schools, then I would suggest if we're done with questions for Kim, then we move on to the next action item to keep the meeting moving.
Absolutely. Kim, any further questions for Kim or discussion items? Okay, hearing none. Kim, thank you for your presentation. We appreciate your input greatly. And moving on to the next agenda item is a discussion on determination of the community spread of COVID-19 designations for schools and current guidance from CDH on school operational plans. And Russ, will turn this over to you for introductory statements. Hello?
Russ, you're on mute.
Russ?
Thank you, Madam Chair. Sorry, I was on mute.
Okay.
The reason I put this on the agenda was because we knew it was very likely that this week for Ada County, not for the other 3 counties, would be moving into the red category based on what we were seeing with the increase in the numbers of cases. And as Dr. Epperly mentioned, that is the single measure that we're using right now to determine community transmission. So that's what that is. It's not telling the schools how they should operate, but it is describing what we are seeing from a public health perspective for community transmission. And when we're in the red category, or pretty much about 700 cases per week here in Ada County, that is substantial community transmission from our perspective. And that's one of the things that Kim also described was with 25% of the cases, there's no known source. And that's where it becomes more concerning, just like it was back when we first started seeing the cases here in March 13th to be exact, was the first case here in Ada County. So what I wanted to just walk you through is that on July 9th, that was the first formal document that was put together, and that's the Idaho Back to School Framework under the governor's signature. And in that document, there's a very specific roles and responsibilities defined for local school boards, state superintendent of public instruction, and also the local health district. So one of those roles, which we've been doing since the schools were back in session for the fall, is to identify categories of community transmission. And again, that's published on our website. We push that out to all of our schools, working very closely with them for our 10 school districts within our health district. And then we also advise local education agencies on operation and health and safety plans. Once again, we've been really involved with reviewing those, helping the schools prepare for the different reopening options from the green category, yellow category to the red category. So it was on September 10th, we were using some metrics that were far more complex than what we're using today. And that was a document that was produced at the state level with our input and the other 6 public health districts' input. But we came to realize fairly quickly that it was not easily understood by the public, and we didn't also feel that it was going to be any more protective and the more simplified version, which is what we're using today. So that was on September 10th is when we decided to make those changes. And referencing back to the Idaho Back to School Framework, the idea was the recommendation, this is back again in July, was that schools go virtual when community transmission is in red. But since then, we've learned a lot more about the disease. And over the last little over a month, we're also able to collect a lot more data on the subject of COVID transmission, what's happening in the school setting, what's happening in the extracurricular activities. So rather than recommend, and again, this is providing the guidance from Central District Health to the schools, recognizing it is 100% their decision on how they operate. and that would include the learning environment that they offer, as well as the extracurricular activities, not just sports, but other activities as well associated with schools. So last week, we put out a document on October 8th that was Central District's Health's position on what we're recommending at this time, with the fact that this may change should we see continued increases in cases. And in particular, what I'm focused on is the hospital data. So as what Kim shared earlier, you can see the hospitals at this time are not being significantly impacted because of the rise in COVID cases. And as everyone on our board recognizes, the hospitals are impacted by cases coming from outside of our district, as well as just what's happening within our own district. So our recommendation we shared with the school districts end of last week is to allow them to continue in-person learning with all of the restrictions they have in place. Some of the things I described in response to Dr. Epperle's question earlier. We have been advising schools as well when we see cases in a school, and again, not necessarily, and in fact, most cases, it's not school student to student or student to faculty, teacher, other staff transmission, but because they're in school and they're within 6 feet of other students or of staff, we're recommending the full 14-day quarantine. So that is continuing, both in in-person learning environment as well as Kim mentioned, more frequently we're seeing this associated with extracurricular and sports that involve close contact and higher cardio, where face coverings are not really practical while engaged in the sports, and physical distancing is not an option either. So that's something that we're continuing to monitor. In fact, within our recommendations, so that's a bit of a difference, is we specifically are recommending, while we're in category 3, that the extracurricular activities be paused. And that's, again, guidance to schools. And we're going to be updating our youth sports guidance to include the same. It's not a mandate, it's a recommendation based on what we're seeing. So I think that's really all I have, Madam Chair, as far as kind of the history, what led us up to today. I think we're keeping, as I mentioned, a very close eye on what's happening within our healthcare systems. And if we start to see them severely impacted, then we're going to have to look at other measures. I'll be glad to answer any questions.
Thank you, Russ. Floor is open.
So, Madam Chair, this is Ted Epperle.
Yes, Ted, go ahead.
Yeah, thank you, Russ, for the information. I totally agree that we track the data, help assess the risk to the community, provide the numbers, red, yellow, green, and let the schools decide based on their operational plans how they put this into play in their schools. I like that. It's a complicated equation. There are equal numbers of people really on both sides of this that want kids in school, others who don't. I know I've gotten a lot of emails. I know all of you have gotten a lot of emails. So I think that we're in a pretty good position of making solid recommendations that's based on data, and we'll let the schools help sort that out to the best of our abilities and the best of their abilities. One thing I've not heard that we're doing, and Russ, maybe you can comment on this, is have we made any recommendations to the schools in an effort to keep the teachers as safe as possible? Recognizing that we're asking them to do quite a bit in this environment. If we're going to have in-person learning, which again is the school board's call, I just want to make sure, what are we doing in regards to the teachers? Now, in particular, I'd like to make one comment here, that something that could help. We certainly do this on the physician side of caring for patients. It goes beyond just face masks. And that is that we have a protocol. Most physicians, especially in the hospitals, are using this. where we fit test N95 masks to teachers so that we get as good a mask as is possible for them, and that we provide some degree of eye protection, or the school districts do, we don't. Either be it a face mask over the N95 or goggles, making sure that gloves are present. I recognize how bizarre this all sounds. I'm sad that we're in an environment where we need to even contemplate it. But one of the key things to that classroom is how the teacher's health is doing. And I don't know if we've reached out to teachers to know how safe or unsafe they feel in the environment. And so my only request, Russ, is in regards to what have we done in terms of recommendations in regards to school teacher safety, in regards to further PPE protection they might use.
Madam Chair, this is Russ.
Yes, Russ, go ahead.
So we have, by the way of our order, required face coverings pretty much at all times when inside primary and secondary schools. And we have a distance of 10 feet where the instructors would need to maintain a distance of 10 feet and not be required to wear face coverings and during instruction, just because it can be difficult. So we have some things in place. We have not gone so far as recommended fit testing, for example. And I am well aware that that is essentially an expectation to ensure that N95 masks work. And that's something that we could certainly talk about with them further, especially for the instructors where they're exposed to a lot of students and they're having to be in closer contact with them at times.
Thank you.
This is
yes,
Megan,
Megan, go ahead.
Madam Chair. Just a quick question with regard
Yes,
to
go ahead.
N95 fittings. So Russ, that's something we use in ag. We have to do it to put certain chemicals on. You know the drill. Do we have someone who's certified to do fitting here so that if we wanted to provide it, say there's just teachers that want to do the fitting, not a requirement, just an availability. Do we have that here?
Madam Chair, it's Russ.
Yes, Russ, go ahead.
I am not sure the answer to that question. I know some of our staff will wear them, so they've been fitted for working with individuals, for example, with active tuberculosis, but I don't know the process and how available that would be. But that's something that we can look into and maybe offer the schools if we can. We just have to staff up to provide that resource. But I think it makes sense. I mean, now that the masks are more available, certainly far more available than they were even a few months ago, and that is the highest level of protection because all the things we wear vary in degrees of thickness and layers, and those are a certified product that are, as you mentioned, Representative Blanksman and Dr. Epley working in the healthcare field, they're lab tested to make sure they work.
Madam Chair, this is Diana.
Yes, Diana, go ahead.
So continuing on sort of the same questions around teachers, some of the concerns are really frustrations that I heard from our school superintendents, even as recently as August, before they were physically present in school, was the amount of time it was taking their teachers to get tested and then get results back. And there was this real disconnect between both the back to school framework and the state testing task force that said teachers should be prioritized, but there was no plan, really. No, there was no, it hadn't been optimized yet. And I know you've been working on some efforts to try and get teachers access to quicker testing. Is that something you could share with us?
Madam Chair, this is Russ.
Yes, Russ, go ahead.
Yes, Commissioner Lasciando, we are working with our healthcare provider community to try to increase access. I will say that every time we seem to find that ideal test capability or rapid test capability, it's always fraught with challenges, PCR test versus antigen test. And we now have it's called Binax Now rapid test, but it is very specific for individuals who are experiencing symptoms. And it's the first step in a testing process. So it will give you the result, either positive or negative. But if somebody's symptomatic and they're negative, then it's still recommended to get the PCR test, which is more difficult to access. So what we're doing, we do have the test kits available. They were provided to us by the state, and we're working out agreements with healthcare providers to actually administer those tests. And we're also in the process of purchasing the Abbott rapid test machines, which are far more accurate, and placing those in the same provider offices. So we're looking at doing this throughout our district. We have an agreement with the 2 test machines we received quite a while ago with Cascade Medical Center and Desert Sage and Mountain Home. And we're in conversation with Dr. Koenig's office, who serves all of Boise County, and they're very interested in getting both the Binax Now, the rapid test with the challenges that I mentioned, and as soon as we get the Abbott test machine, we'll place it in his clinics, and then we'll also be expanding that presence in Ada County, although certainly in Ada County there's a bit more access than what we see in our rural communities. But point being, the focus of the Binax Now testing will be on teachers and staff, and also for students, but for symptomatic, and then increasing access by placing the technology out in the provider offices. But I will tell you, and I know Dr. Young and Dr. Epperly can speak to this, there was this idea, however many millions of dollars it was to increase testing capabilities, but Central District Health is not in a position to secure testing devices or test kits or reagents compared to the rest of our health systems, like St. Luke's, St. Al's Primary Health Medical Group, Family Medicine Residency of Idaho. So what we've said all along is our primary role is to support our healthcare system, not to try to step in and do testing on our own, for lots of different reasons, but the least of which, if you do test positive, you really need to be talking to a healthcare provider, not the local health department, about what you need to be doing, besides the obvious work that we do with the disease investigations and isolation and quarantine advice.
And just to be clear, Russ, I agree with that as a strategy. I don't think that CDH has the staff or the ability to be the central testing hub, but I think the devil's in the details from a communications perspective, and that if teachers, to Dr. Epperly's point, are being asked to come back in the red zone, that they need to know they need to know how they're gonna have access to testing for them to feel confident.
Madam Chair, this is Russ.
Yes, Russ, go ahead.
So on our website, we have and it's pretty well known out there. We can continue to push the message and communicate with our schools. Is you type in your zip code and you can find all the testing sites closest to your zip code. So that's live on our website, and it's been that way for quite a while. But again, the challenge is if you type in your zip code, you're going to find it very difficult to get access to testing, especially for asymptomatic and in close proximity with the technology that will give you accurate test results. So we've had this challenge really since obviously the start of the pandemic, and it's still a bottleneck in I think across the country, but definitely throughout our 4 county communities.
Madam Chair, may I ask another question? Or I'm happy to see if somebody else had a question.
Go ahead.
So I'll just, sort of start with more of a statement. And I think, from the beginning, it's really been helpful to me, Russ, for you to have outlined the overarching goals of protect the vulnerable, don't overwhelm the healthcare systems, and to keep our eyes on that prize. As this drags on, and I've been sort of saying this really since June, I have felt like we needed to add a third goal, which is to get our kids back to school and not just because they need to be learning for their own, academic well-being, social, emotional, etc. It's also truly an economic development issue as well for our community. And I don't think our other counties haven't faced this, but we're now dragging on into October. And I think the parents I'm talking to are very frustrated that their kids are not in school full time for all the reasons outlined, but they see bars are now open again, restaurants are open, those people aren't wearing masks while eating. I know not all of our cases are coming out of there, but I just want to begin a conversation about what would it look like to prioritize in-person learning for our kids? Because even though we don't make that decision as Board of Health members, we do know there's certainly, with good reason, looking at the advice and guidance from Central District Health. So that's a pretty overarching question, but I'd be interested in how the board feels about that, and certainly, Russ, your thoughts on the matter.
Madam Chair, this is Russ.
Yes, Russ, go ahead.
Yeah, Central District Health Department 100% supports education. We talk about the social determinants of health, social influencers of health, and education's right there at the top. We know that this whole situation has been extremely difficult, starting back again in March, where the school year ended early for all of our students, which was a response that probably was appropriate at the time. There was a tremendous amount of uncertainty. We know a lot more about the disease now. As Kim described earlier, we were able to do the disease investigation and contact tracing, and that is why last week we issued our recommendations to our school districts, and that was specific to Ada County because that was the only district we knew was very likely to move into the red or category 3 community transmission. So our position is we very much support in-person learning. We have supported the schools all along with developing their plans, and we continue that pretty much on a daily basis, communication with them, both on the disease side as well as creating that safe learning environment. So again, if you just followed the Idaho Back to School Framework developed back in July, red category would advise our school districts to go to virtual learning 100%. And that's not the position we've taken, nor is it the position we would take unless we see significant transmission in our communities that directly impacts the hospitals. And the hospital side of things is what, if I haven't said it, that's really a focus of our agency right now, is to make sure we don't run into serious problem there where they're not able to take care of their patients properly, or certainly that we start to see more increased spread out in other parts of the community, the vulnerable population that you mentioned, Commissioner Lasciando, where we see more activity like in long-term care facilities, for example.
So I guess I want to restate the question a little bit, though, because I think of this pandemic, and I've said this a few times, is kind of like we're either adding kindling to the fire or we're taking it off. And so adding bars back into the mix, we added back some kindling. Schools reopening, some kindling. And I think for us as a community and potentially as a board, if the cases keep going up, we have to have some really hard conversations about which kindling are we taking off. And that's really my fundamental question. I am really uncomfortable that because the schools are doing such a great job following all our guidance, though I know it feels frustrating to a lot of parents that they feel like the kids are kind of the sacrificial lambs in all of this, and especially when they see all these other activities happening. So that's the conversation I want to start, is if things get worse, what are we rolling back?
Madam Chair, this is Russ.
Yes, Russ, go ahead.
Yeah, and I think that's a great question and a conversation we need to be having with the board ongoing, just like we talked about long-term care facilities. We have a discussion this coming Friday with an individual who's bringing a petition forward to do events, community events that would exceed the cap of no more than 50 for gatherings as an example. So we're kind of heading more in a loosening of restrictions, which I don't necessarily think is a bad thing if they're done properly. Back to the bar scenario that you mentioned, they agreed to operate very much like a restaurant with lots of restrictions in place. So the part that I will say has been difficult, and I know we've talked about this, is on the enforcement side. If we have orders in place, but they're not being enforced, which is not Central District Health's responsibility or even the authority to do that, it makes it even more challenging. If we talk about issuing more orders and how do we, to the kindling example, where do you take that kindling off? And those are conversations we need to continue having and be prepared for the cases continuing to rise and the hospitals to be impacted. That's kind of how the way this works. So I don't have an exact plan like let's do this or let's do that, but I think we really need to be thoughtful about it as we move forward, because no matter what you do, no matter what kindling you remove from the fire, it has consequences, economic consequences, social consequences, etc.
Madam Chair, this is Ted.
Yes, Ted, go ahead.
Yeah, Ross, just one other thought here as we deal with the schools with this. And that is, have we discussed with them or do you know of any schools with operations plans that would allow those kids that didn't want to come, parents and kids that didn't want to come, they could stay at home, they can do online learning, they could even be connected online into the classroom while it's happening. Others that wanted their kids there could have them attend, and they would be in the classroom. There'd be less in the classroom so that we could socially distance them better. They'd be face masked. We make sure that teachers are safe. Have we seen an operations plan like that or discussed with them some sort of mixed model where kids could be educated in person with 60% of the class or whatever it was, 40% perhaps at home, in some mixed model way?
Yeah, Madam Chair, this is Russ.
Yes, Russ, go ahead.
So what Dr. Epperly, what you're describing is to a great extent exactly how the schools are operating. In fact, throughout our district, not just here in Ada County, where online learning is an option, and there's options, right? There's online, and then there's also virtual, to your point, where students could join that classroom without physically being present, but actively participate. And that's what's actually, I think, has helped the schools do as well as they've done in terms of reducing transmission, because if you have 35 students in a small classroom, it's maybe impossible to physically distance like we know works. So that's part of that idea in our recommendations, is to slow the reopening, I call it reopening, but basically bringing all the students back in the classroom. Now that we're seeing the cases rising, we're in category red for Ada County, yellow for our other counties, is that, I think one maybe recently went to green, is that they're doing the things they need to be doing. They have really excellent plans in place. They've been very responsive, as Kim could attest to working with us. And in fact, as you're aware, at least 2 of the schools closed short term in our health district just to kind of figure out what is happening, how many more cases might come out of this. So I couldn't be more pleased with what they've done to provide the best learning opportunities and accommodate the parents and students' preferences, given the degree of risk associated with any type of interaction with others. So I'll stop there.
Thank you.
Madam Chairwoman,
Yes, Megan, go ahead.
unless anybody has any additional questions about what the designation for current guidance is as listed under new business, I would move to adjourn.
Okay, the motion has been made to adjourn. Do I hear a second?
Madam Chair, before we do so, let me just ask Russ a question. Russ, is there anything further on this topic that we as a board need to know before we move to adjourn? Have we covered things to your satisfaction, or are there things that you'd like to make sure the board does discuss with you and the public?
Madam Chair, it's Russ.
Yes, Russ, go ahead.
You know, I think the one thing that we really need to be very aware of is the impact that sports, fall sports, now that everything is ramped up, is going to have on community spread. That's something that I know is a very high priority from the grade school level through the university level. Right now, as I mentioned, we've made the recommendation that those should be paused. I know that that's not happening from what I read in the news. And it's not to say that they don't have great plans in place for sports too, limiting the number of spectators, for example, having students wear face coverings when sitting on a bench, not sharing water bottles, or doing things that help. But from what we're seeing already, and I keep referring back to Kim, she's the expert on this, and it's her entire team of disease investigators and contact tracers. That's an area we really need to focus on our attention, and eventually probably, I would say, when we talk about restrictions and orders, that's something that would come to mind if we start seeing significant outbreaks occurring in that environment. So thanks for the question.
Thank you, Russ. We do have a motion for adjournment. Is there a second?
Madam Chair, this is Commissioner Hasbrook. I'll second that.
Thank you, Elt. Any further discussion before I call for a vote by county? Hearing none, I will call for a vote by county, starting with Valley County.
Commissioner Hasbrook, aye.
Elmore County.
Representative Blanksma, aye.
Ada County.
Green Young, aye.
Ted Epperly, aye.
Diana.
Commissioner Laciando, aye.
Okay, thank you. Motion for adjournment passes, and I do thank the staff and the board for their input. I want to also express our appreciation for the public that participates in listening to our meetings. Our next meeting, as Russ previously mentioned, will be this Friday, October 16th, beginning at 8:30 a.m. So the meeting stands adjourned, and have a good evening, everyone. Goodbye.